do MRIs of the knee most of the time. So we have the femur bone that comes down. We already know that there are the condyles here. Now the knee joins into the tibia and the fibula. The fibula is always what? Lateral or medial? It's on the outside of your lower leg, yes? So of course we need things to connect the bones, and those are going to be our ligaments, bone to bone. And these ligaments on the outside are your collateral ligaments, and they're named for the side that they're on. So this collateral ligament, would that be medial or lateral? Lateral. That would be your lateral collateral ligament. Over here then would be your, and what you see many times is the abbreviation of MCL for medial collateral ligament, or LCL for lateral collateral ligaments, okay? And we all know that there is this floating bone in there that is your patella or your kneecap, right? Okay. If we go deep into the knee, that's where we see the ACL and the PCL. But we actually see the ACL and PCL best in the sagittal plane. We see the collateral ligaments best in the coronal plane, okay? Within the tibia bone, you have a tibial plateau, which is basically where it kind of rises up. It kind of looks like a mountain there, okay? There are, in more traumatic injuries of the knee, we look for tibial plateau fractures. And fractures of that tibial plateau are considered more of a complex fracture, okay?
What planes did you say that the ligaments were best seen in?
The collateral ligaments are best seen in the coronal plane. The ACL and PCL are best seen in the sagittal plane. So we know our ligaments provide stability to the knee because it holds our bones together, right? Here's just some more animated drawings of the, is this the MCL or LCL? LCL. MCL is on this side. Inside the knee, notice how your ACL and your PCL cross. And it's important to understand that because when we position for a knee, we just don't have the leg straight out. We actually have the foot externally rotated, about 5 to 10 degrees. Because by doing that, we don't have to angle as much for our sagittals then. Because our ACL lies in the knee kind of at an angle. And then this way when we angle in our knee images, we can hopefully get that ACL in one image where it attaches from the femur bone to that tibia bone. All in one plane. We don't, or one image. We don't really want to see part of it in one image, part of it in another, part of it. We want to see it all connected into one, okay? So again, here's just some more animated drawings of your ACLs, your MCL, LCLs, your anterior cruciate ligaments. The ACL's main objective or whatever is to prevent the femur from sliding backwards. The PCL prevents the femur from sliding forward. And then your MCL and your LCL keeps the knee from sliding side to side. Now, what orthopedics doctors will do when they're kind of doing a clinical assessment of the knee, if you ever watch them or have seen it on TV, when they hold the knee, they take the lower leg and they can kind of move it around side to side, anterior to posterior. That's how they get a good idea then of what's loose, okay? On MRI of the knee orders, they might say a positive McMurray sign. That is where they've done this assessment and something is loose in there, okay? The positive McMurray sign, a lot of times those diagnoses are used because in insurance companies will say, yes, you need an MRI then. There's certain diagnoses that you'll see a lot because we know those are generally approved for insurance companies to say, yes, you need an MRI, okay? So those are just kind of some things to understand. These are images, MRI images, of the ACL and the PCL. And what's nice about the ACL and the PCL is they are actually a thick ligament. I mean, think about, our knees really have to sustain a lot of the weight that we carry. So these are thick rubber bands. And they actually have different, almost bands to them within this thick rubber band, because you can have a partial tear or a complete tear of the ACL, okay? Anytime I'm looking at these sagittal images, and if I see the ACL start posterior and come to the anterior tibial bone, it's my ACL. If I see it attached to the back of the tibia and then attach at the back of the femur and attaches to the back of the tibia, that's my PCL, okay? So they're both cruciate ligaments, but one attaches anterior, another attaches posterior, therefore it's an ACL or a PCL, okay? And I'll also give you a trick as we're looking at an MRI of the sagittal planes of how you can tell, well, where's ACL versus PCL? Because your ACL will always lie laterally to your PCL. So if I'm going through a series of sagittals and I know that my fibula is lateral, right? So if I'm slicing lateral to medial or medial to lateral, once I know where that fibula is at and I start slicing inward, the first ligament inside the knee of the ACL or PCL will be your ACL. Then it'll go to your PCL. If you're scanning medial to lateral, your first major ligament will be the PCL, then your ACL. Does that all make sense? Okay. Here's an MRI image in the coronal plane. And again, this is where we see these black, remember ligaments are always dark, these black lines that connect bone to bone on either side are going to be your collateral ligaments. Okay, now let's kind of go into the muscles. Well, we've already talked about the muscles in the femur, right? We've got the rectus femoris, we've got the vastus medialis, the lateralis over here. So these quadricep muscles, and in particular the rectus femoris, comes down and it attaches to a tendon called the quadriceps tendon. That then attaches to the patella. If we go distal to the patella, we have another tendon that attaches from the patellar bone to the tibial tuberosity, and we call that the patellar tendon. Now there's kind of been, discrepancies of, well, a ligament attaches bone to bone, right? And a tendon attaches muscle to bone. But the patellar tendon attaches bone to bone, but we call it a tendon. The reason for that is because technically the quadriceps tendon and the patellar tendon are all in one. Because the patellar tendon actually moves because of the quadriceps muscle. Does that all make sense? So when we talk about the quadriceps tendon here and the patellar tendon here, that's because these all work in conjunction with the quadriceps muscle. Okay? So don't get confused of why we call this a tendon here. If I'm looking at a lateral side view, well, I know this is lateral because the IT band, remember we talked about that? That lies along that lateral aspect of your femur, right? So if I see the IT band, I know I'm looking at the lateral view, the outer side view in this sagittal plane, okay? That all makes sense? And here you can see how this quadriceps tendon comes down, and although it kind of attaches to this patella, it also continues on and goes down into this patellar tendon, which then attaches to the tibial tuberosity, which is anterior to the tibial bone. Okay? And here's a nice picture of it here. So any questions on that aspect? Is that confusing at all? Does it make sense? Okay. Here is another picture of how this all works. When we bend our knee, we can see how that tendon is, being pulled, right? Functions of the knee muscles. And remember when I told you that the hip and the knee are kind of opposite each other, right? The quadriceps muscles function to extend or straighten the knee. So therefore, in the knee, our quadriceps are extensors, right? Which was the opposite of the hip, right? Where in the knee, the hamstring muscles function to flex or bend the knee, but in the hip, it really extended the hip, okay? The iliotibial band functions to keep that lateral aspect of the knee stable. So just don't confuse that with what we just studied in the hip, because as we flex the hip, many times that we are extending the knee. As we extend the hip, we're kind of then flexing the knee, right? So they're kind of opposite each other. Okay, the joints in the knee, you have a tibial femoral joint, basically the knee joint, and it's a hinged joint, right? It's just hinged. We can't move it side to side. It's just one way or the other, flex or extend. The patellofemoral joint is really where the kneecap joins or works with the femur there, and that is called a gliding joint. Well, we can, when we're not flexing the knee or even straightening the knee, a lot of times you just let it loose, you can almost move your patella around, right? Okay, it's a gliding joint. There is also another joint between the tibial bone and the fibular bone that allows that fibula to slide forward and backward, and that happens, it's kind of like what we didn't do upper extremity, I guess, yet, but where those two bones, as the ankle's moving and twisting, well, it's also up here in the knee, that tibia and fibular bone are sliding against each other as well, okay? Does that all make sense? As we're kind of going through it, yes.
Is that also a gliding joint? Or not?
Sometimes they call it almost like a pivot joint because it's pivoting, or a radial joint type of a thing. Okay, well, we all know what articular cartilage is because it's the same stuff that's around our hip joint, right? And in the knee in particular, we look at articular cartilage a lot. I mean, as we age, that cartilage becomes thinner and thinner, okay? And so, I'm sure many of you have heard that I had cartilage, they scraped some cartilage out of my knee, or I had some issues with my cartilage, and that's what they're working on, okay? A new term we're going to kind of talk about now is the menisci or meniscus, okay? Menisci is plural for meniscus, and that basically is the shock absorber of the knee. I think of a meniscus the same as I think about a intervertebral disc, right? It's kind of a cushion. You know, we don't want to be walking or running or jumping on our knees if you didn't have a cushion between bone to bone, right?